Today, we're going to be talking about abdominal pain, different types of abdominal pain, and what it could mean. And we're going to give you the functional medicine kind of clinical perspective as well, and give you some action items of what could be the root kind of deeper underlying cause of it all. Most people on the conventional medicine side will just look at surgery and drugs and acid blockers or pain medication as your alternative. And we're going to be looking a little bit deeper. Evan, how are we doing today, man?
I'm doing wonderful. It's
Excellent.
crazy to think about all the different possibilities of stomach pain. We hear this from our clients all the time. Hey, I've got stomach pain. That's one of my complaints. That's why I'm coming to you guys. Please help. And then the question that we always ask right back to them is, well, where is the stomach pain? Because you could say stomach pain and it's like, okay, is this the lower right? Is this the lower left? Is this the top, like right below the rib cage? Is this under the right side of your rib cage? And depending on the location, that could mean a huge different range of problems. It could be something very simple, like you have low stomach acid and maybe you've got some heartburn, to you've got diverticulitis, or you've got some type of bowel disease, or you've got appendicitis. So where should we start? You want to start at the very top of the gut and work our way down?
Yeah, let's start at the top and work our way down. So let's kind of give people a physiology review. And then where there are, let's say, inconsistencies in the physiology, that's where symptoms start to happen. So remember, everything emanates from physiological imbalances, and those imbalances, symptoms increase and progress, and then eventually pathology may progress. Some people, it takes years, depending on how acute or how traumatic the injury occurred, right? So the upper area off the bat on the left side to center is going to be more of our stomach type of symptoms. So on the left, we could have, on the further left here, we could have more pancreatitis symptoms. Now, pancreatitis, most of the time is going to happen with a strong history of being an alcoholic. You can also have potential gallbladder stones that work their way out, and that as they work their way out, there's a place where the gallbladder and the pancreas kind of connect. And if that stone happens just below, it's possible it could back up the pancreas. So your big issues with pancreas are going to be a potential gallbladder stone or being alcoholic. And there's also other types of rare infections that could drive it. But those are the big two on the pancreatitis. Now, on the left side, it's greater likelihood that that's going to be a stomach issue than it is a pancreas issue. But it's good to keep that in the back of your head. As you go midline, it starts to mean that it's probably more of a stomach issue. Dyspepsia, that means indigestion. It could be inadequate stomach acid that's driving a lot of it, meaning you're not having enough stomach acid, you're not breaking down your food. Dyspepsia, which means poor digestion. And then, of course, from that, we can have heartburn because we don't have enough stomach acid. Our esophageal sphincter will not close. Food may rise up from the rotting acids in our tummy, and that can create heartburn. That can create inflammation in the stomach. And then, of course, the more inflamed our stomach is, the nerves that go to the stomach area are on a 2-lane highway to other muscles. And one of the other biggest muscles is going to be the crura of the diaphragm. So that crura of the diaphragm can rise up, or I should say the stomach could actually rise up and pop above the diaphragm. So if here's our diaphragm, here's our stomach, it could pop up and go above it. And that's called a hiatal hernia, and that can affect digestion too. So I'll just kind of lay out those couple of things and I'll let you comment. Go ahead.
Yeah, I had a hiatal hernia and I had an H. pylori infection. So for me, the top center of my gut, right below the sternum, that's where, when I did have stomach